Shoulders.
Ladies and
Everybody
gentlemen,
got to take a picture, right?
welcome to the atrium here at City Hall. We wanted to take a moment today to continue to raise awareness about our lead program here at the City of Harrisburg and to introduce our team, new and old, to the public so that we can put a face behind the people that will be administering this really important program in the City of Harrisburg. We also want to highlight our continuing partnership with Hamilton Health and to show off some of the capability of the new equipment, which we will get to in a moment. But I want to begin by having the honor to introduce our two newest team members. And then I'm going to hand things over to our lead program director, Mr. Damian Slaughter, to introduce the rest of the team. And then we'll come back and I will talk about the partnership with Hamilton Health, which is so important. We conducted an extensive search for two individuals, an outreach person and an intake coordinator that could do both the jobs of going out in the community, raising awareness about the risks of lead, informing the public about the opportunities that this program has, and then also an intake specialist, a friendly face and a skilled face who could bring those people into the system, fill out the proper paperwork, do the intake interviews, and hopefully get people and families the help that they need in Harrisburg. And we were fortunate to find two incredibly strong women right here in Harrisburg, eager to take on the challenges. And the first I want to introduce is Ms. Valanda Harris, who is going to be our intake specialist. Valanda is not only a product of the Harrisburg school system, but she's a graduate of Harvard University. And, I know having gone to a school which is supposedly very competitive in New Haven, Connecticut, I'm not supposed to celebrate Harvard graduates, but I will, because she is a role model for everyone here in Harrisburg about what you can do. And not only did she go off and graduate from Harvard University, but she has chosen to return to Harrisburg and make an impact right here in her beloved community. Has previously worked at Hamilton Health, which is impressive. So we have that connection there. Has also been a stellar performer in our own Parks and Rec department. And frankly, it was time we promoted her to another position here in the city because she's an incredible talent and she will be the friendly face. So remember that face and recognize that that's who you'll be dealing with once you are brought into the program. Equally talented and equally fortunate, we are to have former City Councilwoman Susan Brown Wilson as our outtake specialist. Now, Susan, I've known for many, many years and brings a unique skill set, somebody who has worked very well with our community, has served as an advocate for those in need, knows how to forge partnerships, knows how to get out and work with the school district and has done so in the past, and is going to be absolutely instrumental in making sure that this program reaches as many people as possible and is effective. She has an incredible business background and corporate background, which not everyone knows about, but everyone does know about her time on City Council. And she will bring the skill set and that determination to this job, which I think are going to be so important. So after much searching, after scores and scores of applicants, we feel that we've hired two incredible team members, and they are the new faces of this lead program. Our older face, our face who has, has been here with the city before, first as a deputy director and now as the administrator for this program, is Mr. Damian Slaughter. I would like him to take a moment, introduce the whole rest of the team, and then we'll hand it back over and talk about Hamilton Health. Damian, the floor is yours.
Thanks, Mayor. First of all, we have Edward Colton. He's our project director for construction. He leads our rehab specialists, making sure that our lead certified contractors maintain their certification. One of the rehab specialists is Ray Burnett, David Olson. Then our administrative assistants, we have Judy Ramon, and we have Ruth Riviera. From our fiscal staff, we have Mr. Mark Stone, project director for fiscal management, and we have Donna Holloman, also fiscal management. We have Romulus Brown, which is our project manager. He also assists us out in the community as well as getting out the outreach that we need so we can reach as many families as we can. Of course, we have Roy Chris, our backbone, that helps to get the word out as well, assisted by Miss Jackie Parker, that helps us as well notifying the public of this great need. And I don't think I missed anyone.
You did
Right?
great.
Okay.
That was impressive.
Thank you.
That was impressive, Damien. And we're lucky that we were able to bring Damien back to the city to work on this project. As you can see, I thought this was really important as an opportunity to introduce the whole team, to see the faces of not only our lead program, but our building and housing department, our community and economic development team. These are the ones that are working so hard to make this type of outreach possible. But we really couldn't be successful or do what we want to do without the Hamilton Health Center under the leadership of Janine Peterson and team. They have a facility, and we have a partnership with that facility, which is going to allow us to truly get at those in need and make this program unlike any other, really, anywhere in the country. And I wanted to take a moment today to just show off some of the equipment. We're not going to actually use it, but I thought Regina, who is a nurse at Hamilton Health, could talk to you all for a moment about what would happen if you go to the Hamilton Health Center and you'd like to get tested for lead. Regina?
Thank you. So we purchased a ClearWave lead Care 2 analyzer machine. This machine, it only takes 3 minutes for you to get your results back. It is a quick finger stick with a small lancet. You would use one of these plungers to collect the blood, and if you notice, you only need a little bit of blood. It only goes up to that black line. Once you retrieve the blood, it goes into this little cup, which has a reagent solution in it. You take it back and forth 8 to 10 times. Then you use the actual kit. You add the kit in here. When you hear it beep, it's ready. You take a plunger, you retrieve the blood out of here, and it's a little drop right there on the X. When you hear it buzz, that means it's beeping, and then a countdown begins. I brought things with me because prior to you using this, of course, you have to wash your hands, you have to wear gloves. All needles goes into the needle disposal, and then everything that contains blood goes into the biohazardous bag.
And your results
And the
are
results,
ready
the
right
results
then
are
and there.
ready in 3 minutes. We have a process in place to where anything over, anything 5 or greater, we do refer to the program. If the patient is ours, we do provide further follow-up with our providers. If the client belongs to another PCP, a clinical organization, then we do provide them with those results and we refer them back to their provider. Anyone who comes in has the option of being involved in this program, so we do ask them to sign a consent. We do test, our testing for the community will be every Wednesday from 8 to 12. However, we do have several programs that we are initiating. We're going to have a few community events in our Hamilton Community Room, which is open to the public. And I'll also be working very closely with staff to go out in the community to perform tests at different community-based organizations.
So we'll have regular testing hours at Hamilton Health, but we'll also have the ability to take the tester out into the community at specific times to do testing there.
Exactly. For our Hamilton staff and our pediatric as well as our WIC department, we are offering this screening Monday through Friday between the hours of 8 and 12 in our WIC department. In our pediatric department, of course, we're offering this test all day long.
And it's free of charge.
It is free of charge,
Very
yes.
important. And it's relatively painless and it's quick. And it is a major upgrade over the old days where it had to be sent out and there might be a period of time. Now, somebody can be tested while they're waiting. And if they do test positive, or the child tests positive for lead, then they can be referred right then and there into the city's program, which has millions of dollars available for many positive things. What would happen would be the referral would come from Hamilton Health. The referral would then go to Susan or Valanda, who I just introduced, and that person would complete an application. And after that application was completed, there would be an intake interview that Valanda would do to interview the person, and then we would schedule a lead inspection risk assessment. And actually, Ed would be the one who's scheduling that, which means we would schedule somebody to go out to that person's home. And remember, if you are a grandparent and you have children, or you are a relative, not just a father or a mother, and you have children in your home, even for a portion of the year, you might qualify. Your home might qualify for this program. So we would schedule a risk assessment for that property. We would then send out a property lead inspections team that would come out and do that risk assessment. After that risk assessment was done, there'd be a series of specifications that would be prepared, a bid package sent out to certified lead contractors, and then we would make a reward. Damien would be in charge of making the ultimate reward to the contractor to do the lead remediation for the home, which could include anything from replacing windows and doors to other types of lead remediation to make sure that the home is safe. We have an aggressive schedule to do as many houses as we possibly can, and I think it's important to know that Harrisburg was given this award over many other cities throughout the country, and our award is as great as awards that were received by cities that are much, much larger than Harrisburg. That's a recognition not only of the extent of the need here in the city, but also of the team and the confidence that this grant will be administered well and will really make a difference. So help us continue to get the word out that this testing, as well as the funding to do the lead remediation, currently exists and can make a real difference. Thank you for letting us introduce our team and show you the faces behind the grant doing the hard work. And if you have any questions, we'd be happy to take them.
Just to put into perspective again how important this program is and this partnership is, can you talk to us about how big of a problem this is here in Harrisburg?
Yeah, let me let Damien do that.
Well, when we did our data leading into receiving the grant, our research told us that maybe 90% of our housing stock is pre-78. So we have a very big need for lead remediation throughout the city.
And right now in Harrisburg, are landlords held accountable? Do they have a time frame to fix it? Do they face consequences if they don't fix this problem?
Well, this is just our program specifically. We do work with landlords to remediate their properties as well, but we do hold them to some type of standards that they must uptake. For example, they have to maintain the property for low-mod income families for a period of 3 years. They cannot elevate the rent for the property after remediations are done for an extent of 3 years as well.
How far do you think that
Say that there's a rental property inspection that all landlords have to go through in the city of Harrisburg if they're going to rent property, and that includes making sure that you don't have obvious violations like chipping paint or things that could be hazardous situations. What Damien's saying is that landlords can actually qualify for the program, which is really exciting as well. You don't have to be just a homeowner. You could be a landlord, provided you agree not to increase the rent for a certain period of time and you're serving a population which qualifies. Okay, sorry.
How do you qualify for the program? Is the testing, do you have to go through testing to qualify for the program? Or do you
The first step would be to go through testing.
You have to meet the HUD eligibility requirements. That's based on their income. The most important thing, if they have a child under the age of 6 that's present in their home or spending significant time, or a pregnant woman in the property. If they do not test positive for lead, but they meet the age requirement and the income requirement, they can also apply for this grant.
How far do you think the 3.7 million, I think it is, the grant,
Yes.
how many homes is that exactly?
Our goal is to remediate or clear 180 homes. We want to assess maybe 200, but of course, we're going to try to exceed that goal.
And what's the average cost of remediation?
About $13,500.